Hi everyone, topic of today's video is timing of IELTS for dentistry. My different dental colleagues and dental students, juniors don't know about timing of IELTS exactly. They just rush into IELTS and take an attempt, waste their money even as well. IELTS is hell costly. In Pakistan, it usually costs about 57,400 on computer based, while 63,800 PKR in paper based. While in Manchester, it usually costs you about £225 on computer based. So it is of course very expensive, and you should not waste your just money in this way that even you don't know when you have to take IELTS or not. So big question is why you need IELTS, means what is your requirement and for what reason you are going to attempt it. There are actually three rules. If you are going to take IELTS for study purpose, or if you are going to take IELTS for licensing purpose, then further divided into other routes as well. So these are mainly two reasons, but of course for UK there are three reasons, meaning LDS and ORE have separate questions about IELTS. My first topic is, if you are going on master's program in different countries like Australia or UK, when you have to attempt IELTS, you have to attempt IELTS prior to your admission. Means you must have at least 6.5 to 6 bands minimum. You will then get at least admission in every type of university. Otherwise, if you don't have 6 or 6.5, then 6 to 5.5 is also adjustable. Means there are many universities which are accepting these type of bands as well. So, but your of course range of like universities will be limited. Another thing is, if you are going to take IELTS for licensing pathway, it now depends upon two things. For the two things, number one is you are going to document prior to your exam, or you are going to document after your exam. For example, for ADC, Australian Dental Examination, or for ORE, means of UK dental exam, you have to send your documents in advance. They assess it, and then they allow you or disallow you to take the examination. But in case of LDS, the rule is different. Means you have to attempt first of all LDS part 1, and then for part 2 IELTS is compulsion. Means for part 1 of LDS you don't need IELTS at all. People think that they have to take IELTS before LDS part 1. As you all know, people's interest towards LDS rather than ORE is more, and they don't know what is the protocol of IELTS in case of LDS. And for ORE, of course, you have to give them 7 bands and with no lesser than 6.5 in each module. And for Australian dental examination, you need 7 in all modules as well as overall 7 at least. So these are the requirements for ORE of UK and ADC, Australian dental examination. And for the case of Dubai examination as well, you need IELTS because English is their language as well, but you need lesser bands in Dubai. It is, I don't remember exactly, but I will make another video and will encompass it in that. Of course, but it is almost less like 6 or maximum 5.5 they require bands for Dubai. The other thing it is about, now my question is about IELTS in LDS. LDS part 1 doesn't need IELTS exam. Remember this thing. Whenever you need to give LDS part 1, you just rush into part 1, not IELTS or any other stuff. Nowadays they have opened 50 seats as well for 2024 intake. This would be a very good step from Royal College of Surgeons, England. And for part 2, you must need IELTS. And as you all know that from part 1 to part 2 there is almost like 1 year gap, like securing a seat, and you can easily attempt IELTS in that 1 year. So plan accordingly. If you are going to take LDS examination, you don't need IELTS 7 bands. Means if there is a composite pathway that some people go on masters as well as attempt LDS, so they don't need 7 bands in IELTS for part 1. Remember this thing. They are just focusing on IELTS, and they just tell me that we cannot attempt LDS part 1 because we don't have enough bands in IELTS. Remove this your misconception and think carefully that you can attempt LDS part 1 while without IELTS. And after part 1, you have 1 window for taking IELTS to secure 7 bands in IELTS and then take part 2. So this is far better than ORE pathway. In case of ORE or Australian dental exam, you have to give them all the documentation prior to your exams, and they just assess it in couple of months for Australian dental exam, while couple of years for ORE. That's all about IELTS in dentistry. I hope these all questions will be cleared now, and as I can't respond earlier, so I thought I should make a video on IELTS, and it should remove people's misconception when they should attempt IELTS. So good luck and have a nice day ahead. Bye bye.